So atypical antipsychotics, unlike SSRIs, do not act solely or strictly on serotonin. Uh, they primarily act on both dopamine receptors and serotonin receptors. So some atypical antipsychotics uh, are antagonists, meaning they decrease the amount of dopamine that's available in the brain. Others are agonists, meaning they increase the amount of dopamine that is available. So think of it like this. The prefix ant means against. So antagonists are against dopamine. Agonists are for it. They increase dopamine. And the way they do it is antagonists, there are dopamine receptors. And what they do is they bind to these receptors so dopamine can't bind with the receptor and make you feel good, right? Whereas agonists, what they do is they mimic dopamine. So they act like dopamine and then they bind to the receptor. And so the receptor thinks is getting more dopamine. So antagonists bind and they block dopamine, whereas agonists pretend they're dopamine and bind to the receptor, and the receptor thinks is getting more dopamine, right? Atypical antipsychotics, especially in cases of like OCD, anxiety, and depression, are not typically used in high doses or alone. They're often used in small doses and adjunctively or in addition to medication like an SSRI, right? And so you have a number of atypical antipsychotics. These drugs, unlike SSRIs, do tend to have more side effects. However, if you use a lower dose, these side effects tend to be more limited. One